Do I think Ella has always had autism? This video is for entertainment purposes only. This is not to be used as medical advice. I made a video about this a while back. It could have been like a year ago. In that video, I mentioned how I believe Ella showed her signs of autism ever since the very beginning. But now, I'm starting to rethink a lot of things, and here's why. Ella has a condition called P10 Cowden syndrome that causes a lot of things to happen in the body, including neurological. I do believe a lot of what I was seeing when she was first born and when she was a very young baby could have had to do a lot with the P10. And the reason why I think that's what I was seeing at that time is because Ella had a lot of words, and she was also making eye contact, but just not all the time. She would smile, but just not all the time. She would engage, but just not all the time. She was doing all the things, but just not consistently. She had between 50 to 75 words that she developed very early, saying her several words before 12 months. She was saying up to 75 words until she started significantly regressing between about 17 months on to 2 years to where she had almost no words at all. I look back at videos that I've been analyzing, and I realize now she regressed significantly between that time period to the point where something affected her further, in addition to P10. Now I think about my preterm labor and the fact that I was given a plethora of different things before she was even born. Understanding now that babies are affected significantly within the womb, especially when you're given things for preterm labor. For example, I was given pills to stop my contractions, shots to stop my contractions, magnesium IV to stop my contractions, and a significant amount of antibiotics. Understanding now that the MTHFR mutation seems to run strongly in my family, both copies are there, and understanding that the likelihood of Ella having potentially both copies are high, and now understanding that suppose that is the case and leucovorin has already helped her, which means that she also was not processing folinic acid properly, and potentially neither was I as a mother who was pregnant with her. You can start presenting symptoms of not producing enough folinic acid within the womb. It starts there, especially if I'm not supplementing as a mother because I didn't know. And then on top of that, people that have the MTHFR mutation also have a hard time getting enough glutathione, and they are usually very low in glutathione, which helps your body detox. Me probably already being low on glutathione because I probably have the mutation. Then her being in my womb, not getting enough folinic acid or glutathione, and already having underlying things going on with the P10, she's already not detoxing. Okay? Then she's born, how much antibiotics I was given, and understanding how all of those antibiotics that I was given start her gut off with having yeast overgrowth from the very beginning. From like the moment she was born, basically, she probably had yeast overgrowth, and I wasn't giving my baby probiotics. Then we didn't understand enough about holding off certain jabs because of the potential for immune compromise, right? Because of conditions that are underlying, because we didn't know about these. And this is our first child, so we gave her first jabs when she was born, and we gave her the recommended ones after. However, we did try and spread some of them out because we're like, this is a lot. But the doctor at the time would only let us wait a week. So that's all we got in between. So I'm looking back on this. Although she was developmentally doing a lot more things than even she's doing now at 9.5 years old. She was developing a little bit slower on some of her motor skills. As far as the educational stuff, she was thriving. And then it regressed so suddenly and significantly. If you don't have a child that you've experienced that regression with, something is not right, okay? Something's going on in the body. There's a lot of people that don't understand that about autism, I don't think. There's so many different reasons to develop autism, okay? So she has yeast overgrowth at this point. She is not getting enough glutathione, potentially. She's not getting enough folinic acid. She's already immune compromised because of her P10. She is already susceptible for having an issue with inflammation in the body, probably because of her P10 already and the MTHFR mutation, because she's not getting the glutathione to detox, which makes you susceptible to inflammation. And then she just keeps getting jab after jab after jab, Tylenol, 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 right? Because that's what they recommend for sickness every time they have the slightest bit of sickness. And after the jab and the Tylenol, then depletes your glutathione more and more and more. And her body can't even keep up anymore because it can't detox very quickly because there's so many jabs when they're very, very young. Things escalate. Things escalate very quickly. And it makes so much sense why she would lose her words and why maybe she has so many toxins built up in her body, why she would start developing intense stimming behaviors, which didn't start until closer to about 2 years old. Her hand flapping and intense stimming behaviors didn't start until closer to 2. It's very interesting when I take a look back now and have some of the information that I have now. It makes you rethink the whole thing, and my mommy intuition is connecting all the dots, and it's going ding, ding, ding.